All right, ladies and gentlemen, and esteemed members of BNI and honored guests, I'm thrilled to introduce a distinguished member who is making his inaugural presentation here at BNI. Dr. Aaron, our featured presenter this week, is not just a chiropractor, he's a visionary dedicated to elevating the standards of chiropractic care. What sets Dr. Aaron apart is his unwavering commitment to providing a level of service that goes above and beyond. He takes pride in debunking stereotypes associated with chiropractic care, reshaping the narrative, and offering a unique approach that transcends traditional expectations. Step into Dr. Aaron's office and you'll immediately sense a distinctive atmosphere. It's not your typical chiropractic experience. It's an environment carefully crafted to reflect his mission and his values. Star Wars decorations, some might think unconventional, yet they're captivating and they contribute to the unique ambiance that sets his practice apart. Without further ado, let's give a warm welcome to Dr. Aaron as he shares his presentation on the active motion approach to chiropractic care. Dr. Aaron, the floor is yours, and we look forward to gaining valuable insight into your innovative and transformative approach. And I will give you a friendly 2-minute warning.
Thank you, Whitney. I appreciate it. Let me see if I can share this right. I am gonna try to do this. I haven't done one of these here, so let me see what happens. Let's see, where's my slideshow? Oh no, sorry everybody, I'll find it. There we go. Okay, can everybody see that? Yes?
Looks great.
Awesome. Thank you, Whitney. Dr. Montgomery, Active Motion Spine and Rehab. I want to chat with folks today about how I do things. I thought about presenting to you all on super exciting topics like low back disc herniations and nerve pain and all kinds of cool stuff, but I didn't want people to fall asleep. So since I haven't met everybody, I would like to talk with folks about how I do things here in my clinic and what it is we do. So who am I? Here's a bunch of pictures of me and my family. First and foremost, I am a family man, a father of 4. I have 2 stepchildren older. One of them's not really pictured here because I didn't have any new ones of Kyle. He lives down in California. This young lady in the corner is Anastasia. She's my lovely daughter. And then the other 2 boys are Emmett and Jack. And my world revolves around this group of people and my wonderful wife, Kristen. And this is just some of the many things we like to do. So yeah, that's who I am. This is the stat sheet, so to speak. I'm not going to bore you with it all. I've been in practice for almost 14 years exactly. I've got a whole bunch of education and a whole bunch of training and all kinds of things. And but that's not the important stuff. What do I do here at Active Motion? I'm a chiropractic physician, a doctor of chiropractic medicine. But it's more than just traditional chiropractic. I am not a rack and crack 'em, send you on your way clinic. Some of us have all been to chiropractors like that, where you're there for 5 minutes or 10 minutes and you get an adjustment, which can feel really good, but doesn't always take care of everything that's going on with folks. So I do provide joint manipulations and adjustments. It's a very, very important part of what I do here. But we also provide a lot of soft tissue work and myofascial therapy. We use many different tools to do that. We work on mobility and strength with patients. We do a lot of functional movement. And I even get into a fair bit of very golf-specific medical care and fitness training. Everything here at Active Motion is incredibly patient education centered. I want everybody who comes here to understand what it is we're doing and why we're doing it, and why I'm asking you to be so involved and accountable in that process. It helps create independence for patients dealing with any type of musculoskeletal pain. Cool thing is, and this is probably one of my favorite things about my clinic, it's also a teaching clinic. I work closely with the University of Western States, which is the 2nd oldest chiropractic university in the world. It's where I graduated from. It's also where I worked for a number of years as one of their clinical directors. Now, in my own private practice, I am a CBCE practice site, community-based clinical education site. And over the last coming up on 12 years, I have had 170 plus senior chiropractic residents, spend anywhere from 6 to 9 months in my clinic, finishing clinical rotations, seeing patients, writing chart notes, making referrals, doing all the things that they're going to do when they enter into practice. This little photo down here is last year's group of residents that came through, and they're all out there practicing chiropractic and helping lots of people today. So this is cool because I feel like the patient really wins in the setting in here. The game changes a little bit from what you normally experience. It allows for longer, more personalized visits because we can see and schedule 2 or 3 or sometimes 4 patients simultaneously. You get a team-oriented approach to your care. We're always talking about all the care in here and having case conferences, and you get a team approach. And working with the residents who are here, finishing a very intensive 4-year program, means I stay on top of current research and best practices, and I do lots of continuing ed to make sure we're not just doing the same old thing that I've been doing for 14 years. So it's a super fun setting. A little bit different. This is important to me, and I love this movie. Get the answers you deserve when you come here. I'm not better than primary cares, but it's different. Typically in a primary care office, a patient will see that doctor for maybe 13 to 15 minutes is the average. And you might actually only see your primary care provider for a couple of those minutes and the other time spent with nurse or admin. They're often going to get a medication prescription, generic treatment plans like wait and see for a couple of weeks. And that's what typically happens. In your typical chiropractic office visit, you might get a 5 to 15 minute average. And oftentimes, most of those clinics are doing adjustments only. They also come with often larger treatment plans that can be very, very expensive. Here at Active Motion Spine and Rehab, I love to do nice long initial evaluations, 60 to 90 minutes. Let's take time to know you and what's going on with you. Longer follow-ups, 30, sometimes even 45 minutes. Customized, personalized treatment plans. And we can even order all the imaging and make referrals if we need to here. So should you see me or an MD, a DO, naturopath, nurse practitioner, it's not an either or thing. We do different things. MDs, DOs, they have their place and they're incredibly valuable and needed. The bulk of their training is in disease processes, internal medicines, pharmaceuticals, medication prescriptions. They take much less focus on musculoskeletal conditions and neurology, which is what I focus on. And MDs will be the first people to tell you, that group will tell you they're largely ill-equipped because of the healthcare system to deal with neuromusculoskeletal problems. It's not their fault. It's just a product of the system, and they want to help with that. They're just not set up well to do it. Naturopaths, as a side note, they tend to get more of a blend of medical training and then also musculoskeletal chiropractic type of training. Us, on the other hand, we're trained heavily in neurology and anatomy and joints, a ton of time spent in this in school and postgraduate education, heavily trained in joint manipulation, heavily trained in physiology, how the body works. And I get much less training in public health and medication prescription. So we have our roles. And what I want to be is I want to be a reliable resource for those people. We work very well together when it's structured right. So I'm an expert in these conditions like low back and neck pain, shoulder and knee, headaches, nerve pain, sciatica, all the things. And I just want to be a nice resource for those people who have patients who have those conditions. When an MD refers a patient to me, the patient will usually see far more favorable results than if just prescribed pain medication and a wait and see strategy. The patient leaves that trusting that primary care even more because they got them into a place where they got good results. So talking a little more about this, I help with more than most people think. Most people think chiropractor, like, oh, it's my neck and my back is out and they just crack me and that's what I do. We do so much more than that. I deal with shoulder pains, hip pains, knee pains, foot, ankle, head to toe. I can address and evaluate it all. And that's how we do things around here. Our approach to care is systematic. We look at the spine, the neurology in the spine, the peripheral neurology, muscles and joints, the local muscle and joints. And by systematically and carefully evaluating that, we get to the specific root causes of things and put together a good plan. We do a lot of hands-on treatment here in the clinic, manual therapy, joint manipulation, both to the arms and legs and the spine. And then, as the name says, lots and lots of rehab here, movement training and strengthening. It's a large background for me. Our phases of care, this is important. Phase one is just your get out of pain. Like, let's get pain off the board so we can start making changes and get you to phase two, which is getting back to day-to-day life and doing the things you love to do. And then once you're out of pain, let's keep rolling. And that's where I like performance care, where we start utilizing the gym here in the clinic and getting you stronger and more resilient so that you don't re-injure yourself. What you can expect, or an MD can expect, when they make a referral here is one, a nice three-way email or a BNI app referral. Patients can also just schedule via the front desk or online. I will personally connect with any of those referrals if they would like to ask me questions beforehand, see if this is even the right place for them to be and what I do. After that, we schedule an initial evaluation, get them in, do the systematic approach to things where we get clear answers on what is going on with that person and what we need to do to help them. We'll make sure we check any insurance benefits. I am in network with all the insurance companies and happy to work with them. And we make sure we don't burden any patients with any big treatment plans that sometimes cost thousands of dollars. I just talked with a patient yesterday who was experiencing that. So that's how it looks here, and happy to help out however we can. And I welcome any and all of you to send MDs or come over and see it for yourself. Thank you very much.